Botox is known for smoothing out facial lines. It is also been effectively used in various medical conditions which involve muscle spasms like chronic migraines, overactive bladder. In recent years, Botox has been successfully used to treat vaginismus. Now, you may be thinking, wait, isn't Botox used for wrinkles and cosmetic treatments? Today, we are talking about a new treatment that's becoming more popular, which is Botox for vaginismus. So in this video, I'll explain about what vaginismus is, why Botox can help, and how the procedure is done, whether it is safe, how long it lasts, and what to expect after the treatment. So what is vaginismus? So let's start with the basics. Vaginismus is a condition where the muscles of the pelvic floor, specifically the ones around the opening of the vagina, tighten or spasm involuntarily on their own whenever there is any attempt at penetration. Now, this could happen during sex or when trying to insert a tampon or a menstrual cup or even during a routine pelvic examination. These muscle spasms can make any form of penetration very painful, difficult, or even impossible. So, vaginismus is more common than what many people think, and it can affect women of all ages. It is also important to understand that vaginismus can be caused by a variety of reasons like past trauma, anxiety around sex, or even lack of familiarity with one's own body. It's a condition which should never be ignored because it can deeply affect a woman's sexual health, confidence, and her relationships. So why Botox? Botox or botulinum toxin works by temporarily paralyzing the muscles where it is injected. So in case of vaginismus, the Botox is injected into the muscles of the pelvic floor, specifically the muscles that involuntarily contract and cause pains. So by relaxing these muscles, Botox helps to prevent the spasms which make the penetration painful, allowing the woman to engage in a sexual activity or any kind of vaginal penetration without discomfort. Now, Botox provides relief because it interrupts the cycle of muscle contraction. Now, women with vaginismus often have an automatic reflex which tightens the pelvic muscles when the penetration is attempted. So now let's understand that how is the Botox procedure for vaginismus done. So now let's talk about the exact procedure. Now, this procedure is actually quite simple and minimally invasive, and it can be done in an OPD setting or under GA in case you are not comfortable with the pelvic examination. First, your gynecologist will start by thoroughly examining your pelvic floor muscles to determine where the injections need to be placed. Now, Botox is typically injected directly into the muscles around the vaginal opening, which are responsible for the spasm. And depending upon the severity of your vaginismus, multiple injections may be given in different areas of the pelvic floor. The whole thing usually takes just about 15 to 20 minutes, and after that, you can go to home immediately or after a few hours in case the procedure is done under general anesthesia and resume most of your daily activities from the next day. Most of the women experience significant relief within a few days to maybe a week after the injections, although it may take a couple of weeks for the full effects to be felt. Is Botox safe for vaginismus? So the short answer is yes, absolutely. So it is important to choose a doctor who is experienced in administering Botox for vaginismus, as the correct placement of the injection is the key to achieve the desired results. So one of the most common questions which I get about Botox for vaginismus is, how long will it last? The effects of the Botox obviously are not permanent, but they do last for several months. And typically the results could last anywhere between 3 to 6 months. And in those 3 to 6 months with regular sexual activities, the muscles tend to retrain themselves well. During this time, the muscles remain relaxed, and many women are able to retain their pelvic floor muscles to stay relaxed even after the Botox effect wears off. In some cases, additional treatments may be required to maintain the benefits, especially if the vaginismus has been a long-standing issue. But for most women, maybe just 1 or 2 treatments can provide a long-term or maybe even permanent relief and significantly improve their quality of life. After the treatment, the doctor is going to likely recommend avoiding sexual activity, tampon use, or any kind of vaginal penetration for just a few days to allow the injections to take full effect. You may experience some minor discomfort or bruising at the injection site, but usually it typically resolves within a few days. It is also important to follow up with your gynecologist, who can recommend pelvic floor therapy or exercises to help retrain and relax those muscles, and also to sort of teach them how to function normally without going into a spasm. So for best results, it is better to combine Botox with the pelvic floor therapy. So if you or someone you know is struggling with this condition, please know that there are effective treatments available and you don't have to live with pain and frustration. Don't forget to hit the like and subscribe button for more women's health tips and insights from Maitri. Until next time, take care.